Hello and welcome everyone. We are very honored to have you all with us today. بخير هاتني همولا یک دکین زور خوشحالین با آمدبونی برستان. I am Dr. Rafa Salim, a medical doctor at the KRG and the local coordinator of the project in Erbil Governorate. Now we would like to invite the General Director of Planning of the Ministry of Health in the Kurdistan region, Dr. Vian Mohammed Jaf, داوای لبرزی دکین بفرمایید لستر ستیج بو پیشکش کردنی و تعریف.
بناوی خوای گەورە و مهرەبان ئامادەبوانی بەڕێز میوانە قەدرگرانەکان بەخێر بێن سەرچاو لە جیاتی بەڕێز وەزیری تەندروستی حکومەتی هەرێمی کوردستان بەڕێز دکتۆر سامان حوسێن بەرزنجی و لە جیاتی تەواوی وەزارەت بەخێرهاتنی یەکێکە ئێوەی بەڕێز خۆشەویست دەکەین بۆ ڕۆژێک کە لای ئێمە بەڕاستی بەدرینی دەزانین لەبەرەوەی هەمیشە هەوڵمانداوە کە سەرەتایەک دۆزینەوە بۆ ئەنجامدانی ریفۆرمێک و لای زۆر بمان ئاشکرایە کە ئەو بابەتە بەوە دەست پێ دەکات کە داتا و زانیاریەکانمان هەوڵ بدەین کە بە سیستماتیک بکەین بۆ ئەوەی هەم کاتەکان بگەڕێتەوە بۆ ئێمە هەر کاتێ ویستمان بەدیکێک کۆیکەینەوە و هەمیشە ئەو بەڕێزانەی کە لەو بوارە ئیش دەکەن ئیتر سەرقاڵی کۆکردنەوەی وەرەقە و لاپەڕە و ئەو شتانە نابن و بە زووترین کات زانیاریەکان دەگاتە فەرمانگەکان و دەگاتە وەزارەت ئەوە بوو کە خەونەکە لە 5 تا 6 ساڵ دەستی پێکرد لە 2015 ئەوانە بەڵام سەرەتاکەی لەوە بوو کە ویستمان ئەو سیستمە بە ئەلکترۆنیک بکرێت بەڕاستی ئەوەی کە هاتە پێش زانکۆی ڕۆما تۆر ڤێرتاگە ئۆکەی لەگەڵ پاڵپشتێکی تەواوی بەڕێزیان و پاڵپشتی ئیتالیان کۆئۆپەرەیشن کە ئەوانش لەکراوی ئیتالین هەم لە ڕووی مادی و بودجە هەم لە ڕووی مشک و ڕاهێنان و هێنانی ئەو بەڕێزانی کە بەڕاستی ئەزمونیان هەیە لەو بوارە و خەبیرن و لە زانکۆکەی خۆیان ئیشی باشیان ئەنجامدا بوو و توانیان چەند بەڕێزێکیش سەردانی ئەوێ بکەن و بتوانین کە بەشێک لەو زانیارەی لای بەڕێزانە لێرە کاری پێ بکرێت. سپاسیان دەکەین و هەمیشە بەڕاستی بەردەوامبوونی ئەو پرۆژەیە و سەرکەوتنی لە ئەو بەڕێزەیە کە تەنسیقی دەکرد کە کۆمیونیکەیتەر بوو بەینی ئێمە و ئەوان کە بەڕێز دکتۆر فایقە لێرەوە حەز دەکەین سپاسێکی زۆری بکەین زۆر سپاس دکتۆر فایق و هەموو هەوڵانە بۆ بەردەوامیدانت بەو پرۆژەیە لە ئێستادا نزیکەی تقریباً نزیکەی 60 ترکەی تەندروستی هەروەها زیاتر لە ملیۆن کەیس داخل کرا. زۆر سپاس زۆر بەخێر بێن سەرچاو. Ladies and gentlemen, I'd like to, on behalf of His Excellency Minister of Health, I would like to welcome you all in this very special event for us because it deals with a data system and an information system which is very important in our view, in our goal to be a first step toward the health reform. Actually, your support is very appreciated because the University of Rome Tor Vertaga and also Italian cooperation was very supportive for us through budgeting, through training of our staff. Thank you very much for everything. In spite of the crisis, the war, everything, the process continues until now. We have more than 60, around 60 health.
We thank Her Excellency for her kind words. Now we would like to invite the Governor of Erbil City, Mr. Omed Xoshnaw, دعوة لجنابي دكين بيت بوستر ستيج بوتني وتارك.
برئيس دكتور سامان برزنجي وزيري تندرسي حكومة هرێمی كردستان، برئيس آنو جوار وزيري گواستنەوە گەیاندن، بەڕێز دکتۆر سەباح زێباری سەرۆکی لێژنەی تەندروستی لە پەرلەمانی کوردستان، بەڕێز دکتۆر جوتیار عادل سەرۆکی فەرمانگەی میدیا و زانیاری حکوومەتی هەرێمی کوردستان و وتەبێژی حکوومەت، بەڕێز قۆنسوڵی وڵاتی ئیتالیا، هەمولایەکتان بەخێر بن و ڕۆژتان باش. بە ناوی پارێزگای هەولێر بە خێرهاتنی گەرمی هەمولایەکتان دەکەین و بە تایبەت بە خێرهاتنی گەرمی ئەوانە دەکەین کە لە شارەکانی دیکە لە شوێنی دیکە ئەمڕۆ لە هەولێری پایتەختن بۆ ئەو بابەتە گرنگەی کە بەشێکی گرنگ لە کارەکانی حکوومەتی هەرێمی کوردستان دەبێتن. پلان و بەرنامەی کابینەی نوێمی حکوومەتی هەرێمی کوردستان یەکانگیر دەبێت لەگەڵ ئەو ئامانجەی کە ئەمڕۆ لێرە باز لەو بەرنامەیە دەکرێت و لە کارنامەی حکوومەت و بەتایبەت جەنابی سەرۆکی حکوومەت هەمیشە تیمی حکوومەت ڕادەسپێرێ لەسەر ئامار لەسەر داتا کارەکان بکرێتن. لای هەمووانیش ڕوونە پشتبەستن بە داتا و بە ئامار بۆ دروستبوونی بڕیاری دروست باشترین و دروستترین ڕێگایە کە بڕیاری دروست لە چوارچێوەی داتاوە بدرێتن. بۆ ئێمە بەناوی پارێزگای هەولێر وێڕای سوپاسکردن لە بۆ قۆنسڵی وڵاتی ئیتالیا و حکوومەتی ئیتالیا و زانکۆی ڕۆما کە ئەو بەرنامەیان لەگەڵ وەزارەتی تەندروستی ئەنجام داوە و بۆشەوە دڵخۆشین حکوومەتی هەرێمی کوردستان بە تایبەتی وەزارەتی تەندروستی بە تایبەت لە دوای هاتنی ڤایرۆسی کۆڕۆنا هەمیشە لەگەڵ داتا مەعاملەی کردیە و لەگەڵ داتا سەرۆکاری کردیە ئەوە جێگای دەستخۆشیە و لە نەتیجەشدا بە دڵنیاییەوە کارەکان بەرەو باشتر و چاکتر دەڕواتن. و هەروەها هەنگاونان بە ئاراستەی حکوومەتی ئەلکترۆنی و تەعاملکردن بە بەو بابەتە پێشوەچوونێکی دیکەیە دیسانەکە لە دوای دامەزراندنی کابینەی نوێم و ڕۆژانەش دەبینین لە هەموو بوارەکان لە وەزارەتە جیاوازەکان لە فەرمانگە جیاوازەکانی حکوومەت لەو ئاراستەیە هەنگاوی باش دەهاویشترێتن کە ئەوە لەلایەک کاتگەڕانەوەی بۆ هاوڵاتیان لە لای دیکەوە کەمبوونەوەی ڕۆتینە لە لای دیکەشەوە دوورکەوتنەوەی لە میزاج لە چوارچێوەی ئۆرگانیدا و بە شێوەی دامەزراوەی تەعامل دەکرێت. دووبارە بەناوی پارێزگای هەولێر بە گەرمی بە خێراتنی هەموو لایەکتان دەکەین سوپاس و تەقدیر بۆ هەموو هاوکارانی کە لەو بابەتەدا هاوکار و هەماهەنگ بوونە لەگەڵ وەزارەتی تەندروستی بۆ ئەنجامگەیاندنی ئەو بابەتە و کاتەشی خۆش. زۆر سوپاس بۆ هەموو لایەکتان.
We thank His Excellence for his special words. Now, we would like to invite Her Excellence, the Consul General of Italy in the Kurdistan region of Iraq, Mrs. Serena Muroni, to deliver her word. Prego, Signora Consule.
Your Excellency, the Minister of Transport and Communication, honorable members of Kurdistan Regional Government and Parliament, His Excellency, the representative of WHO, distinguished Italian delegation, and all honorable guests. It is my privilege and I am extremely happy to be here today and to participate in the presentation of the results achieved together by University of Roma Tor Vergata and the Ministry of Health of KRG, and of course to hear about the way forward in the next phase of the collaboration. I have been lucky enough to follow this project since its very beginning, since University of Tor Vergata and KRG started a collaboration to establish the first public health information system of KRG. This sounded at that time like an extremely ambitious project, with no precedents in the Kurdistan region or in Iraq, and even with little to none in the whole Middle East. But the Italian government has believed in this project, financing it since the beginning through the Italian Agency for Development Cooperation. For us, this was only natural, knowing the quality of the work of Tor Vergata and the commitment of the KRG to ambitious reforms, and given our own commitment and history in supporting the development of the health system in the Kurdistan region. Now, we all know the importance of universal health care and that health-related sustainable development goals. And to achieve these goals, we need mechanisms that focus on measuring and on reporting. Therefore, efficient health information systems are required, and this is, as we know, one of the priorities of WHO. Thanks to the cooperation between KRG and Italy, the KRG health information system has been developed, put in place, and currently extended to all 4 governors of Kurdistan. This monitoring includes now about 30% of all public health facilities in the region, collecting every day large amounts of data on disease events in public health centers and hospitals. The potential of such system, of course, is immense in terms of understanding, of evaluating, and of monitoring the health of the population, as well as the effectiveness of the health interventions, because with monitoring, a public health system can efficiently identify priorities, guide policies, and develop short and long-term strategies, making evidence-based decisions. Furthermore, monitoring is a key instrument to prepare the health system to respond to present and future emergencies. And this is something the coronavirus pandemic has tragically shown to us everywhere in the world. Countries where more effective systems were in place were also better prepared to counter the spread of the virus and to set up efficient vaccination campaigns. Through this collaboration with Italy, Kurdistan has created the conditions to achieve such a result. This has been made possible thanks to the efforts of University of Tor Vergata and, if I may, to the vision and the tenacity of Professor Emberti Gialloreti, who is unstoppable. Not even this pandemic could put his activities on hold. And of course, of His Excellency, the Minister of Health and the Minister of Transport and Communication, who have believed in this project since its very beginning. With these premises, this kind of commitment, the KRG Health Information System has the potential to become one of the widest sentinel surveillance systems in the Middle East. And we, as Italy, are proud to be on your side. Thank you.
We thank Her Excellency for her kind words. Now, we would like to invite the head of the Department of Biomedicine and Prevention of the University of Tor Vergata of Rome, Professor Leonardo Palombi. Please, the stage is open for you.
Honorable Minister of Health, Signora Consul del Governo Italiano, WHO representatives, dear colleagues and friends. In a brief greeting to all of you, I would like to underline the importance of this meeting for many reasons. Certainly, we celebrate a collaboration, and I would like to say a real friendship between our countries and the academic and scientific realities that we represent, collaboration and friendship, that have not lasted for a short time, but now for years. The young KRT professionals who are about to receive their PhD at the university they represent in public health or information technology are a concrete expression of this collaboration and of the bond that we would like to continue for the years to come. Today, they will be talking to us about the results of this important scientific and cultural initiative with solid benefits on the health and life of KRG people. I consider it a first fruit of our collaboration, and certainly not the last. We do hope to host and train many other young people in our university in the future. However, let me insist on another interesting side of our initiative. Someone might think of health data and their management as a secondary, inconsistent aspect, almost a complement to more substantial needs, equipment, drugs, building. We live in a world where hardware loses importance and software, understanding of reality, information management, intelligence in recognizing problems, has a growing role and becomes a vital strategic factor. The gap between developed countries and countries with limited resources will be increasingly measured by the gap in research, cultural processes, and training in the smart management of resources and in the ability to communicate and share ideas. I want to give you only 3 examples to support my thesis. The management of COVID-19 has shown how much the lack of efficient information systems on the ground has cost some countries a huge price in human lives and economic damages. Or I think, secondly, of the Great Recovery Plan, the Next Generation Initiative, that should launch the new phase of Europe. Many hundreds of billions of euros will be invested in digital and IT, medicine, in territorial networks, and their management, because this aspect has been recognized as a priority by the Europe of 27 countries. Also in the United States, the Biden plan of 1,800 billion reserves 400 billion US dollars for home assistance and its IT network, infrastructure, for President Biden is not only bridges, roads, or means of production, but also smart informatic networks for managing the health of the people. In conclusion, our collaboration looks to the future of our peoples. We are happy to work in this direction, and I feel these young professionals as the ambassador between Europe and Middle East of this promising scenario. Thank you so much.
Leonardo Emberti, which is from the University of Tor Vergata of Rome, he has accompanied the development of health information system in Kurdistan region since the beginning. To deliver his word and start the presentation, please, Professor, welcome.
Excellencies, colleagues, dear friends, we are going today to present the health information system that the government and the Ministry of Health of the Kurdistan region have set up. Why are we going to do that? There is one very simple answer to this question. We are going to do that because a health information system is a response to a need, a response to a health need, a need which has been clearly highlighted by the WHO, and I thank the WHO representative and head of a mission in Iraq to be here with us today. The WHO has clearly highlighted the importance of health information systems when it stated that interventions in a country like Iraq, in a region like the Kurdistan region, should center on developing universal health coverage and the development of health information systems. But the importance and the need of health information systems has been also highlighted by the government of KRG, which has put in its agenda, among the necessary reforms, the enhancing of the public health sector, and particularly the development of digital services as soon as possible. And allow me to add that when in February 2020 we met in Rome with His Excellency the Prime Minister of KRG during his visit to Italy, and Minister Ano was present as well, one of the points we discussed was exactly that of public health and digitalization. So, health information system is a need. But we should also add that the need of health information systems has been highlighted also by the pandemic we are living in. Information systems, we know, have played a key role in responding to the outbreak of COVID-19. The WHO in Europe, in Africa, in different parts of the world, has highlighted this aspect. And it has become more and more clear that strong health information systems are needed for facing the pandemic, but also beyond the pandemic. So, the health information system, the Ministry of Health of Kurdistan is setting up, is already working. As already mentioned before by the Director General, Dr. Vian, who has followed the development of this system since the very beginning, already 60 public health centers and public hospitals are now collecting daily health data and information. But the goal is to connect throughout the next years all public hospitals and health centers of the region. But the goal is also to go beyond that. The goal is to reach the whole of Iraq. Excellencies, colleagues, dear friends, the Kurdistan Health Information System is becoming a model for the whole of the Middle East. And we should thank the Minister of Health for his work and all that could be achieved, thanks also to his efforts. But before concluding this first part of the presentation, allow me to stress one more issue. The real strength of any endeavor, the real strength of any project are the people. Yes, the real strength are the people. Of course, buildings are important, money are important, roads are important, of course, but the real strength are the people. And Italy has invested in the people of Kurdistan. Italy has invested in the people of Kurdistan, has invested in education, has invested in training. And today, you will appreciate, I believe, the results of this investment. And I would like, at the beginning of this presentation, to commend the women and the men of Kurdistan that have created all what we are going to see today. The staff of a health information system has worked hard. And this staff, who was trained with the support of Italy, is now training hundreds of our people. All the health centers and hospitals which are now working have a staff which has been trained by the people from Kurdistan. So, Italy has accompanied the development of the Kurdistan health information system. And let me thank here Her Excellency the Consul of Italy to be here today. The role of Italy has been important, and Italy will continue to accompany the development also in the future. However, the health information system is now yours. It is your health information system. It is in the hands of the people of Kurdistan. That's why I stop here and I leave the floor to the women and to the men of Kurdistan who have developed and are running the health information system of Kurdistan. And let me call, first of all, Dr. Faiq, who since the beginning has coordinated the whole activities of this system. Please, Dr. Faiq.
Thank you, Professor Leonardo. Now, we will continue as Professor Leonardo has highlighted the main point, why health information system is important and why we choose DHIS2. Now, WHO at international level strengthened that having a good and precise working health information system is important to improve the health outcome. And that information is an important part of a health service as a whole. So, presence of a health information system actually is important for a good leadership and governance function. WHO again make it as an ethical commitment and obligation for the countries and for the states to provide a good health information system that's working and providing a good data that are important to provide a good population health services. The WHO again at regional level, the Middle East, they are strengthening a health information system and they put it as a priority for WHO in the region. The WHO insists that a system that depends on ICD coding will be a good option, and they suggest DHIS2 as a platform to be chosen for this reason. And actually, this is what we did during our work and during these last 5 years of our work. So we choose DHIS2, which is suitable for this area, and it's depend on ICD-10 coding. Now, regarding Iraq, coming to the Iraq, WHO said that the system in Iraq is outdated and depend on paper forms. And you know, this system, the old one, has a lot of limitation, a lot of difficulties regarding the quality of data, and the flow of the data from the periphery to the center is difficult, and having a good quality of information is important to make the health decision. At the level of KRG and Ministry of Planning in KRG, they have made studies, and again, they put the development of health information and having a surveillance system as a priority and as a need for Kurdistan region. In the subsequent analysis, the Ministry of Health of KRG also highlighted this point, and they said that one of the most important recommendation is to establish a health information system for primary health care centers to provide good health surveillance for our patient at the primary health center levels. Now again, as we know and as we have been mentioned before, one of the priorities and goals of new cabinets of Kurdistan region is to improve the health services and to make digital services in all of ministries and offices of the government. And our project and our goals meet together here to provide these services and to achieve these goals. So data are the key element in evidence-based decision in public health, and the data are needed for a good programming and planning and evaluation. Now we will finish this part. We will go in the detail of the structure of KRG Health Information System. What are the structure of this system, so that you be more oriented about the details, and I will leave the floor to my colleague, so Dr. Haveen will continue with you.
Dealing with the structure of the KRG, first of all we have to deal with people training. I myself have been trained from the University of Rome Tor, and now I am a PhD student of this university. During these years, many people have been took two different aspects. On one hand, training of people, of hundreds of doctors and health professionals on developing a culture of data, training on the basics of public health and of disease coding, and on deciding upon data, deciding how to use this data. A second aspect of these training activities is training of people who's involved directly in the Kurdistan Health Information System. أنا درست من training أرتبنا كلامش بدايته training of more than 160 people have been done directly in the public health centers and public hospitals for the people who are entering data directly into the health information system. Training done in the places of their work in the public hospitals and public health centers. تدريبه ما أبا أمبيرودلي هر دمانه ما سردان تهين و هر جهة كي أم ستافر سفلمية أم تبريد بكين أم اشتين ديكش نويره face to face ستافر data entry إيكا أم نشاط دين practically حتى باش فرد بد بشتين جيج متابعة مستمر يا هاي أبش صالة دوزة بشازي ورا وحتى نكا همي دوا مستمر أم تجربه. So, a large number of people have received training and knowledge about the health information system and about the use of data to make health decisions.
Kurdistan. It's an open source, and it's been used and already implemented in 60 countries around the world. When we need to implement the KRG health information system in any center or hospital, we need some essential needs. First of all, we need some human resources, just like the doctor said, we do the trainings. And then we need some basic equipment, just like a computer, hardware equipment, and we need some internet access to continue, because the program is online. So we need some basic equipment to keep it running in the centers. The health information system of Kurdistan. Currently, it started by collecting five different programs. It collects disease diagnosis and hospital discharges. It does registration of births, also death and immunizations. But keep in mind, this is not fixed. The program is very flexible. The system is very flexible. Other needs could be added to the system as well, depending on KRG needs. Also, the program is based on ICD-10 coding, which is recognized by WHO as an international classifier for diagnosing. And to show the flexibility and the modernity of the system, it's already been prepared to use ICD-11 once it's released. Another feature of the system, that because of Kurdistan, in Kurdistan there is some hospitals and health centers, they have their own local database. For this case, we can import data, which means that they don't have to change to the system completely. They can keep using their own system, but regularly we can import the data to the system. And this is very important, because we will not lose any data that was already entered by the health system here. بنوعات مختلف database يعني زور مختلفة بس التانيين هم important كانوا سيستمها. So we will not lose any of these informations.
So far we have been talking about the structure of the system. Now from here we will be talking about one of the most important and interesting parts of the presentation, which all of you, I'm sure, have been waiting for it, which are the results. Now, so far we have collected 1,250,000 number of events, which makes it one of the biggest public health databases in the Middle East. And we, as Kurdistan region, are proud of this. If I say it in Kurdish, Shanazi Pio da Kain Barasti. So breaking this number down, we have 850,000 number of outpatient records from 60 public health centers. We have 350,000 records for the inpatient events, and we have 59,000 number of deaths or causes of death registration, and 100,000 number of birth registration. There is one point to clarify here. In here we talk about the events. It's also very important to integrate the data and the information of the individuals. And happily, the country is working on the new identification system and new ID for the community. That will help and support to integrate the events with the individuals or the patients in a very near future, hopefully. Now, one of the key elements in every health information system is the GIS and geopositioning. This is very essential for any information system. That will tell you, or that will enable us to visualize the location of health units on a real-time base on the map, on a very quickly, the system enables us to see the number of recorded cases on the map per district and location at any point of time.
Okay. Now we came to the public health center coverage by the KRG-HIS system. And in this graph, you can see that the coverage of the public health centers by the system is about 50%. By the end of course of 2022 will be 50% in some regions, and this is by the end of 2022. Of course, we will not stop here, and the system will continue and with continuous informatization of data. We will hope that it will continue to include and to cover all the PHCs of the Kurdistan region into the system. Until 2021, this is for, of course, for all of the PHCs in Kurdistan region. And you can see there is a very large number. And we can clarify more here in this graph. You can see that this graph showing the most common or the most frequent diagnosis of the public health centers in the region. Here you can see the minor respiratory illnesses took most of the place, and almost 40% of all the reasons for outpatient visit to the primary public health centers. Minor respiratory illnesses like acute tonsillitis, common cold, or pharyngitis. And this can give us information how to distribute the resources, whether it is human resources or other resources like equipments or pharmacology, to distribute over these PHCs, of course according to the need of the PHCs, and not to waste resources. And here in this line graph, you can see that this line graph for 4 years, 2016, 17, 18, 19. And most frequent diseases for all the years is nearly the same, with slight differences in percentage. And what did this tell us? This tells us that our data, the KRG-HIS data that are collected are accurate and not biased, but it is not like that, and so nearly the same for all the year. So this means that the system data are correct and stable data. Of course, with expanding the project to include all the PHC in the Kurdistan region, these graphs will be more accurate and will give us more precise statistics. What do we have? What we have just talked about for the public health centers, now we are going to talk about also for the public hospitals. So until now we have talked about the public health centers, but from now on we talk about the public hospitals. Regarding the coverage for the public hospitals, same like the PHCs, our goal to achieve by the end of 2022, which means next year, is to include more than 50% of the PHCs of the public hospitals in some of the region, and we will continue to expand to include all the public hospitals of the region in the system. This graph shows the most frequent diagnosis of the general hospitals. What we mean by the general hospitals, we mean that this is not including the maternal hospitals and the pediatric hospitals, just the general hospitals. We can see that the diseases of the respiratory system and the disease of digestive system together took almost half or 50% of out of all the other diagnoses. This is also good information to know which kind of diseases are most common, what kind of human resources we need in these places, in these general hospitals, and to distribute resources according to the need, and to distribute equipment according to the need, and not wasting them. Then we come to the pediatric hospitals. Regarding the pediatric hospital, خەسخانی مناڵان بۆ نمونە داتاکانمان زۆر جیاوازە ئەبینین نەخۆشە گوازراوەکان زۆرترینن. For example, in the pediatric hospital, the diagnosis the graph is changing. The picture here is not like the PHCs and the general hospitals. We can see that the infectious diseases took about almost 75% out of all the other diagnoses, which also should raise the public health awareness why this large number of pediatrics are involved or are infected by the infectious diseases, and to particularly take action in this area. And finally, regarding the maternity hospital, for sure the pregnancy, childbirth, and puerperium took most of the place and the highest percentage for highest reason for attending the maternity hospital and admission to maternity hospital. Whereas also maternal factors affecting the health status and contact with health services are the second most common factors. So what I want to conclude here, I want to say that all these graphs and all these statistics that are collected by the KRG-HIS system will give us information and will inform us that what are the most common diseases according to different hospitals, according to the PHCs, what are the needed of the PHC, what the resources are needed for the PHCs, what resources are needed for the general hospitals, as well as for the maternal hospitals and for the pediatric hospitals. So we can divide or distribute these resources accordingly and to not waste them. بۆی لە کۆتایی بەشەکی من ئەمەوێتەوە باس بکەم کە ئەم داتایانە گرنگیان چیە کە ئێمە لێرە داماناوە گرنگیان ئەوەیە کە ئێمە بزانین ئەو نەخۆشیە باوانە چین کە لە سەنتەرەکان هەیە مەڵبەندە تەندروستیەکان هەیە و هەروەها لە نەخۆشخانەکان لە نەخۆشخانەی مناڵان لە نەخۆشخانەی ولادا بۆیە بەپێی ئەوە پێداویستیە طوبیەکان دابەش بکرێت نەک هەڕەمەکی بێت و بەفیڕۆ بچێت.
Allow me to come back just for a minute to add one more aspect of the features of the health information systems. Until now, my colleagues presented data which have been collected through the system. But these data, these collected data, allow us also to provide estimations beyond the data collected by the system itself. And we have developed some statistical models which allow us to estimate the numbers that we are interested in. For example, as you know, already we have included in the KRG health information system a certain number of public health facilities. But through these public health facilities included in the system, it is possible to estimate the number of visits for all public health facilities in the Kurdistan region. And at present, our estimation is the one that you can see here. So, of course, the more public health centers will be included in the system, the more reliable will become these estimations. So here you see an estimation of the possible total number of visits in the whole public health facilities of the Kurdistan region. And it is possible also to estimate similar data regarding some specific region or provinces. But beyond that, it is also possible to estimate the overall population living in the Kurdistan region affected by a a certain problem. For example, it is possible to estimate the number of people living in the region with a certain health problem, for example, diabetes. Of course, again, the larger the health information system will become, the more precise will be this estimation. And we can have similar estimations just for the adult population or just for the pediatric population. Similar estimations can be done for specific areas of the region. In the same way, it is possible to estimate the number of overall hospital admissions in the whole region. Always starting by the data which are included in the health information system. In the general hospitals, we can estimate the number of admissions and also the number of admissions according to different diseases. We can do it also for the pediatric hospitals, which of course have different rates of admissions in accordance with different kind of diseases. We can do it also with maternity hospitals. As you can see, a health information system allows to have a picture, not just of the areas covered by the health information system itself, but it allows to estimate a larger picture for the whole region. The system that the Ministry of Health of Kurdistan is setting up is also beginning to collect information, not just about diseases, but also about procedures. What hospitals are doing, how many surgical interventions for a certain kind of problem, how many surgical interventions for another kind of problem, and so on. Of course, the system is just beginning to collect this kind of data. In enhancing the system, the Ministry of Health will be able to clearly identify the number of procedures which are being done in the different hospitals. This is looking forward into the next years. So until now, my colleagues have shown the data of hospitals, of public health centers. But the health information system is working as well on the causes of death. And to do that, I leave the floor to my colleague.
Part of the information that we can get from the program is related to the causes of death. Causes of death is that the reason why people die. According to WHO, analyzing why people die is one of the main key elements to understand the health situation of a region. So that's why the program is also concerned with this type of data. We collected data from Registration Bureau of Birth and Death, and also from the Forensic Medicine Department in different areas. The data we collect were not coded or have any classification. So each individual record coded and analyzed and coded by using WHO International Classification of Disease. Here we can see that we have causes of death due to natural causes of death, that is disease, and the external causes of death, that's accident, injury, burn, and so on. ليه ردو جوردا تامان هي ما كان هوكاري مردنا كان عن جاوازة يكي كان هوكاري مردنا بهوكاري طبيعي كان خوشيا أو يتريان هوكاري مردنا كي رودايا رودايا هاتو شوية كشتنا خنكانا لو جودة داتها. Here we can see that through different years the percentage is quite similar. If we look deeper at the natural causes of death, we can see that through the year that the most common causes of death is cardiovascular disease, and then followed by cancer. This was for the overall population, but if we look at the different age group of population, we can see that, for example, for young children, the most common causes of death is infections, while for the older population, the most common causes of death is cardiovascular disease. للتماني من عوكانا ابنين كازورترين هوكاري مردن بريتيا لا أوجورنا خوشي كابلين infectiona وليريا جورنا خوشي كي جاوزة بوتمانا كان. Of course, the more information that we can get from to the program, the more precise our result will be.
What I would like to add here is that the KRG Health Information System can be easily used to develop the any kind of statistics, graphs, tables, or any aggregated data. They requesting statistics. The system here very simply can present these statistics and almost automatic way. How? By using the day-by-day collecting data. During the forthcoming months and next year, we will continue to train people not only on entering data, but also to develop or extract their own statistic according to their needs. People who work in the PSCs, districts, or even in the governmental levels, جهنا جلق عرضة كم باكي بنجهك تندرستي يلجي الكامبا دوميز. أكاد أنبهن, if you will see these forms, there are many kinds of forms, and we can, and they took time, too much time till they prepare them. We can, in this system, we can prepare all these data in a very short period of time. And by just training them on how to aggregate these data correctly. The flexibility of this instrument is a tool to decrease the paperwork done by the health staff and to give them more ability to give more time for the patients. I will give the floor now for Dr. Faiq to present the rest of the.
Just before closing this presentation, I would like to add just a few points. Beyond all advantage of the health information system that has been mentioned till now, we have published many scientific papers depending on the data from this system. So by now, the health information system become a reference for health information data about in Kurdistan. So many at international level, and these studies are published, and they considered valuable health resources and references. So as you see, many topics has been published, and now the health information system can provide the data to the health authorities when they need it at different levels. So if WHO need these resources at the international level, we can provide it. The Directorate of Health immediately can have an access to these data when they need it to health planning. The Ministry of Health, for sure, when they need it, this health information can flow very easily and immediately, plus the others health authority, plus the central government if there is need and according to connection and desire with Ministry of Health. Now we are here, but we will not stop here. Our long-term mission is to cover all over the Iraq, but
Excellency Minister of Health in Kurdistan region, honorary members of Kurdistan Regional Parliament, Excellency Madame the General Consul of Italy, colleagues, distinguished guests, ladies and gentlemen. First, I'm honored to speak to you about a subject that is really, really dear to my heart. It is the information management system that we just saw today. And I want to say it in a language that my grandmother would understand. We need to know more so we can do better. Not that my grandmother understood in English, but still, I'm just telling you, simple words can take you where you need to go. Now, I prepared the whole speech, and I spent a lot of time trying to get all the facts and the data, but the colleagues have actually mentioned most of what I had in my speech. The other thing is I was honored to hear the name of WHO at least 15 times. And it was mentioned in the presentation about 9 times. That tells you a lot. That tells you that WHO is putting the health information system at the heart of our action. But let me just take you a little bit to history. Possibly all of you know Mohammed Ibn Zakaria Al-Razi. I think everyone in this room should know who he is, and I think you should be proud, exactly like the gentleman who was saying that he's proud of the presentation. The Al-Razi was possibly one of the first public health people. He was charged by the Caliph to choose a place for a hospital. And what he did, and that was in the year 805, he took pieces of meat and he put them in different parts of the city and he monitored them every day. And he noticed that some pieces rot a little bit less fast than others. And he started to take from there that the air is fresher or even like more pure in some areas and possibly not in other areas. He not only discovered the right place for the hospital, but he created the basis for information management in public health. The other thing, few centuries after, we have a gentleman called Dr. John Snow. I think everyone here knows about the story of John Snow and how he used the map of London to really discover which area is giving us the cholera Vibrio within London. That was in 1813. So more than 2 centuries ago, information management was already very important. Now, coming to our day and age, the World Health Organization actually based all its work on information management. The more we know, the better we can do. So now, just a few years back, we're speaking about how we promote health. We know more, so we can advise better, and some people who come as patients may come as clients, and possibly would not fall sick, and we would not need to waste resources. I heard that word more than 3 times, and it's very important. The other thing is we serve the vulnerable population. And the third thing, we try to keep the world safe. All this is based on information management. So let me deep a little bit more in information management. The colleagues have spoken about 3 or 4 elements: gathering data, possibly making observations, computing, analyzing that data, but more importantly is creating information, because data is not information. And more importantly is putting it in a form that people can understand it and can use it. So data is used for decision making. And I want here to congratulate first the Ministry of Health of Kurdistan, Italy, and the colleagues who will be able to know exactly what decision to take, and we will be able to help our decision makers to have evidence-based programming. It's exactly the direction of the future. We are with you. We would be honored to be part of this endeavor, to help you also.
To welcome all of you, Your Excellency, Mr. Ahmed Zouiten, Minister of Communication and Transportation, Excellency, Spokesman of KRG, Dr. Gialloreti Adel, Her Excellency, Ms. Serena Muroni, the Consul General of Italy in Kurdistan region, and WHO representative and head of mission, Dr. Ahmed Zouiten, our colleagues, Deputy Minister, Consultant and Director Generals, WHO staff, and our guests and our friends from University of Rome, Italian cooperation, and all of our directors and our colleagues in the ministry and directorate generals. Very welcome all of you. It's our pleasure to welcome you, and we meet you again in such important and advanced project, which is one of the important workplace in KRG program working on digitalization and electronic government in the 9th cabinet of KRG. Once I would like to thank you, all of you, especially thank you for University of Roma, Mr. Leonardo, and both of, again, Mr. Leonardo, and Italian Cooperation Association, and all of our staff, our colleagues, especially Dr. Faiq, for his hard working since last few years. And also I would like to thank you and more appreciate to the Consulate General of Italy in Kurdistan region for all of their effort and provision and help and support for our facilities. Thank you for WHO and WHO staff in Kurdistan region for more cooperation, especially in the beginning of pandemic until now, for their analysis, for their epidemiological weekly reports and all. سپاسی هەموو لایەکتان دەکەین بەڕێز دەناوی وەزیری گواستنەوە گەیاندن ئاهمەد زەوهەر، بەڕێز دکتۆر جوتیار عادل وتەبێژی حکوومەتی هەرێمی کوردستان، بەڕێز کۆنسولی گشتی ئیتالیا لە هەرێمی کوردستان، بەڕێز دام و دەستگا تەندروستیەکان وردە وردە گەورەکردن و فراوانکردنی هەرچەندە بەداخەوە بەهۆی بڵاوبوونەوە تەشەنەکردنی نەخۆشی کۆڕۆنا ماوەیەک ئەم پرۆگرامە وەکو ڕاوەستانێک یان هێواش بوونەوەی بەخۆ بینی، بەڵام دەرفەتی کۆڕۆنا و دەرفەتی بڵاوبوونەوەی ئەم نەخۆشیە دەرفەتێک بوو لەگەڵ دەست بەکاربوونی کابینەی نوێمی حکوومەتی هەرێمی کوردستان بۆ چوونە ناو چاککردن و چاکسازیکردن لە سیستەمی داتا و زانیاری لە ئەلکترۆنکردنی حکوومەت و داوام دەستگاکانی تەندروستی و بە تایبەتیش چەندین پرۆژەی گرنگ کە لە ماوەی ڕابردوودا ئەنجام درراوە. جێگای خۆیەتی سوپاس و ستایشی هەموو تیمەکانی ئەم کارە بکەین و جێگای خۆشحاڵی بوو بە چەند نیشاندەرێکمان بینی لەو پرزنتیشنانە جێگای دەستخۆشی هەموو لایەکتانە لە هەمووی گرنگتر من دەمێ ئەوە بڵین کە بە شانازیەوە جێگای پێدان و پتەوکردنی متمانەی ئێمە بوو بۆ هەمومان کە بەڕێز لیۆناردۆ باسی لەوە کرد سیستەمی داتا و زانیاری تەندروستی لە هەرێمی کوردستان دەبێتە مۆدێلێک لەسەر ئەو ڕێچکەیەدا دەبێتە مۆدێلێک لەسەر ئاستی ڕۆژەڵاتی ناوەڕاست ئەمە متمانەیەکی گەورەیە و تین و گوڕی کارەکانمان زیاتر پتە دەکات و هەروە کە بینیمان بە سیستەمێکی زۆر پێشکەوتوو بە واستەی ئەو سیستەمەی کە حکوومەتی ئیتالیا پاڵپشتیمان دەکات بینیمان زیاتر لە 1,250,000 ڤاریەبڵ یان کە ئێوە ناوتان لە نابوو ئیڤنت یان حالەتەکانی تەندروستی لە داوام دەستگاکانی تەندروستی لە هەرێمی کوردستاندا ئامادە کرا و ڕاهێنان بە زیاتر لە 126 ڕاهێنەر کراوە بۆ ئەوەی ئەو سیستەمە ڕۆژ بە ڕۆژ بەرەو فراوانترکردن و گەورەکردن و زۆرتر بکەین. ڕۆتینێک کەم کردەوە کە لە زۆر وڵات ئێمە دەبیستین دەبێت هاوڵاتی بچێتە داوام دەستگای تەندروستی چەند ڕۆژێک و دواتر نۆرە بگرێت و جارێشتر ئەمە ئەم ڕۆتینەی کەم کردوتەوە و سوپاسیان دەکەین بە هەمان شێوە دوهەمین سیستەمی داتا بۆ دەرەنجامەکانی ڤاکسین ئێستا کە ئامادەیە و کە لە ماوەیەکی ئایندەیەکی زۆر نزیکی ڕۆژانی داهاتوو ئینشاءڵڵا دەکەوێتە بەردەستی هاوڵاتی لە بۆ خاوەنی ئەو کۆدەی کە ئێستا بۆتە مەرج لە هەندێک لە وڵاتان لە وەرگرتنی ڤیزا لە سەفەرکردن لە فڕۆکەخانەکان هەڵگرتنی ئەو کۆدە QR کۆدە سیستەمە نێودەوڵەتیە ئەمەش هەموو ئەوانە بە ئەلکترۆنکردنی کاروبارەکانی حکوومەتە کەمکردنەوەی ڕۆتینە و سیستەمی داتا و زانیاریە بۆیە هێڵت ئینفۆرمێشن سیستەم لای ئێمە گرنگی و ئەهەمیەتی خۆی هەیە جێگای خۆیەتی من سوپاسی بێپایان بۆ حکوومەتی ئیتالیا هاوڵاتیان و خوشکبرایانمان لە هەموو هاونیشتمانیانی ئیتالیا بکەین بە حکوومەت و بە بەتایبەتیش کۆنسولگەری وڵاتی ئیتالیا لە هەرێمی کوردستان و خودی بەڕێز جەنابی کۆنسڵ سێرینە زۆر ڕۆڵی هەبووە بەردەوام تەوازنی هەبووە لە ساڵانی ڕابردوو بەبیرمان لەناو ئاوارەکان لە پەناهەندەکان لە هەموو شارەکان چەندین پرۆگرام ڕەنگە ئێستا من دەبیرم نەبێ هەموو شتەمە بژمێنم کە ئیتالیا دەوری هەبووە لە دابینکردن و سپۆنسەرکردنی هەر وەکو پرۆگرامەکانی خزمەتگوزاری تەندروستی ئافرەتان خزمەتگوزاری تەندروستی منداڵان دروستکردن و پەرەپێدانی بەشەکانی چاودێری تر پرۆگرامەکانی ڕێکخراوی UPP بۆ تەندروستی و سەرەتایی و دەرونی لە بنکە تەندروستیەکان هەروەها بۆ دانانی سیستەمی ڕێدیۆ سیستەم لە ئەمبولانسەکان و دابینکردنی پێداوی پزیشکی و ئەمبولانس و هەموو ئەوانە کە ئێستاش لەو پرۆگرامەش سپۆنسەر و بەشدارمانن جێگای خۆیەتی سوپاس و دەستخۆشی هەرێک لەو بەڕێزانە بکەین کە بەشدارن سوپاسی ڕێکخراوی تەندروستی جیهانی جارێشتر بکەم بۆ بەردەوامیان لە پاڵپشتیکردنی ئەم پرۆگرامانە من تەنها دوو داواکاریم دووپات دەکەمەوە یەکێکیان بۆ وەزارەتی گواستنەوە گەیاندن بەڕێز جەنابی وەزیری گواستنەوە کاک ئانۆ لێرەیە کە هاوکار و پاڵپشت بێت بۆ دابینکردنی پێداویستەکانی ئەم سیستەمە بۆ هەموو داوام دەستگاکانی تەندروستی لە دابینکردنی نێتوۆرک و ئەنتەرنێت و بەڕێکارێکی باش تاوەکو سەرکەوتنی باشتر بەدەستبێنین هەروەها داواکاری ڕێکخراوی تەندروستی جیهانی WHO بۆ پەرەپێدان و سەریعکردنی ئەم پرۆژەیە هاوکارمان بێت لە دابینکردنی ژێرخانی ئەم پرۆژەیە یان لە بنەی تەحتی وەکو پێداویستیەکانی کۆمپیوتەر و داتا بیس و ئەکسسەریەکانی تر کە پێویست بێت دڵنیام ڕێکخراوی تەندروستی جیهانی زۆر بە ئینتەرێست ئەو بابەتە وەردەگرن و هەروەها ئەوەی ماوە بڵێم کە سوپاسی حکوومەتی هەرێمی کوردستان فەرمانگەی میدیا و زانیاری بکەین لەبیر نەکەین کە پاڵپشتێکی گەورە و سپۆنسەرێکی زۆر گەورەی ڕوبەڕوونەوەی کۆڕۆنا بوونە ئەوان بوون کە ئێمەش سوودی گەورەمان لێبینین لە سیستەمی ڕێکلامکردن بڵاوکردنەوەی پەیامەکان و بە سیستەمی داشبۆرد کە سیستەمێکی ئۆنلاین و ئەلکترۆنی یەکجار گرنگ بوو لە وڵاتانی زۆر پێشکەوتوو هەمان سیستەم ڕەنگە ئەگەری ئێمە باشتر نەبێ خراپتر نەبووە من سوپاسی بەڕێز کاک دکتۆر جوتیار عادل دەکەم کە دەبێت بزانین ئەمانیش لزور سيستم كان بيوندي كردن لقال هي كان بيوندي كردنو وزور لبرنامج كان يما خوي وتيما كي لقال معنا سباس بوهم اللي كان زارج تربى خير بين زور سباس.
We thank His Excellency for his kind remarks. Zor spas Barez Dr. Saman. We wholeheartedly thank our dear guests for attending today with us and for everyone else for their efforts and for making this happen. So we will be pleased to meet you at the ground floor in the lunch venue to join us, please. Please take your rest. Thank you.